Hi, I'm Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, New Dentist Coach Podcast Show, where we bring you information, tips, and strategies about you as a new dentist, whether you're a pre-dental student, a current dental student, a dental resident, or a new graduate that's been practicing 5 to 8 years. You ask those questions, you send those questions right over, let's see where we are, right there at newdentistcoach@gmail.com. Also, be sure to subscribe to my YouTube channel, Dr. Darwin Speaks, as I will be posting videos on a weekly basis on Mondays, Wednesdays, Thursdays, Fridays, all the days. So I don't want you to miss out on the content. Today's episode, we're going to be talking about how to prepare for dental school after you've gotten the acceptance. And as you're preparing to move and relocate to school, how you are going about preparing for that. And today we have an incoming D1 first-year dental student, Dr. Jojo Hardin. Hey, Jojo.
Hello.
So first of all,
I was saying hi, everybody.
Yeah. Well, first of all, congratulations. And we're going to hear a little bit about your story, but just want to get it out there. Thanks so much for your time, but also thank you for applying. Thank you for pursuing a career in dentistry, and congratulations for getting accepted. You got your first win, and first step in becoming a dentist is getting into school and getting ready to prepare for that first year. So I just want to say congratulations to you.
Thank you. I feel like that's one of the longest parts too, but I am trying to prepare for the mini rigors that are coming my way in the next couple of weeks. So yeah, excited and nervous all at the same time. So
that's right. It's all good. It's supposed to be that way. So tell us a little bit about yourself, so everybody else knows also.
So I am, as you know, D1, incoming D1. I did my undergrad at Lamar University. It's in Beaumont, Texas, a little small town. Small city, should I say. And I took a brief break after my undergrad and went to Texas A&M in College Station, Texas, where I recently finished a master's back in December. And that's when I actually applied to dental school this past year. So
that's great. What was your master's in?
Biomedical science.
Biomedical science. Okay. That's good. You have any dentists in your family at all?
I don't. I am the first. I'm actually the first to, I think, pursue any professional, of my knowledge anyway, that's here home in the U.S. I have another relative, but she's from the Netherlands, and she pursued a career in medicine, but I am the only one here. So yeah, I'll be the first. Hopefully
that's right.
Many more.
That's right. You're paving the way. That's great. That's awesome. So you mentioned one of the things that a lot of people are doing these days. I'm just loosening up my tie here so we can get to business here, so we can find out a little bit about how to prepare. You mentioned your master's in biological sciences, and that's one way that's an avenue that a lot of people are taking. Some people are taking as far as taking a year and doing some additional schooling to kind of up not only their background in science, but also to enhance their acceptance. Was that something that was recommended to you as a way of preparing for dental school or preparing to apply to dental school? How did you come across that opportunity?
So initially it wasn't well, it was recommended to me by advisors, but I don't think that it was like a necessary thing for me, because my undergrad GPA was okay, but I had still not taken my DAT exam yet. So with all of that being said, I wanted some time to prep and prepare to take. I was so scared to take that exam. I just kept running from it. And so I wanted to take some time and prep myself for my DAT exam, which I ended up taking in February of 2017. So in doing a master's program, it definitely did help me as far as gaining a little bit more opportunity to take higher level science courses anyway. So, but I know for the application process, your undergrad GPA and your graduate GPA, they put it all into one big cumulative GPA. So it did help boost me a little bit, but I think that I would have had an okay shot maybe applying in my undergrad, but I hadn't gotten my DAT exam taken yet. So.
Okay. So you mentioned the DAT and also your GPA. So what was your undergrad major?
My undergrad I've got a bachelor's in biology. But before I decided to pursue a career in dentistry, I was actually a nursing student. So, and that did not work out for me. I learned very quickly, well, not too early on, because I was pretty far into the program before I realized that nursing was probably not going to be something that I wanted to do. So a lot of the coursework that I had was pertaining to my nursing degree. So it actually took me about 6 years to finish my undergrad, which is quite a bit of time compared to what it should be anyway, a 4-year degree, and it ended up taking me about 6 years to do that. So, yeah, I was all over the place initially, but yeah, then I ended up with dentistry. And I also I thought that I wanted to do dental hygiene to post nursing, but yeah, I just decided to take on the challenge of something even bigger. So
yeah, and you did it too. You took on that challenge and said, you know what, I'm not even gonna bypass. I don't have time to bypass. I'm just gonna go for the big degree.
The big shebang.
The big shebang. So you mentioned so what was your GPA roughly around undergrad?
Undergrad GPA, my cumulative GPA, I was sitting at a 3.3, I believe, which was, okay. Like I said, I think that if I would have taken my DAT exam and scored a really nice score, then I probably would have been able to land an interview or so. But competitively, I know that for Texas anyway, if you're not sitting at like a 3.5, so from what I've heard anyway from some people, but I know some people who got in with scores of what I had anyway. Yeah. But if you're not sitting at about a 3.5 or 3.4, 3.6, all of that, then kind of overlook your application in the initial screening. So, yeah, like I said, doing the master's, I feel like I probably could have had a good chance of getting in if I would have taken my DAT exam and scored really well. But I don't regret doing the master's because it helped me in the long run as well, even with my grades and everything, my cumulative GPA anyway. So.
And not only did that master's program help you get into school, but it's going to help you while you're in school as well.
Yeah.
This first year. So that master's actually was a good preparation for you, which you're getting ready to experience now coming up in August. So that was a good preparation that you probably didn't even realize you were doing at the time that you were doing it. So that's great.
For sure. And it, it wasn't too, I finished in December. So a lot of some of the coursework I know, and I took like a physiology class my last semester. Ooh, Lord. Don't know why I waited to the last semester to take that course. It was the hardest course in the program, but I feel like that course definitely is probably going to prepare me for what's coming up with gross anatomy and everything.
Oh, yeah. Getting ready for gross anatomy.
It definitely benefited me doing the master's program. I don't regret it at all. So, got my study stamina back, all of that good stuff going. So I'm kind of prepared a little bit, but I'm never try to underestimate what's going to come to me. So
yeah, it's going to be a lot. You're going to be introduced to probably about 10,000 new words, some of which you've come across in your undergrad and also your master's program. Tell us a little bit about what the school. Well, first of all, we know you got into Texas A&M Baylor College of Dentistry, so that's a plus. That's great. So congratulations on that. Tell us a little bit about what they've been doing or how they have been communicating with you incoming D1s as far as what to do, how to prepare for this first year. What communication have you gotten from them?
So once you're accepted, I got accepted back in December, and the school actually sends out about 3 packets before the first day of class. Well, before orientation anyway. I have orientation on the first, well, starting on the first, and the first packet. They just send out a list of things that need to be completed before the first day of class, like any shot records, all of that stuff, and CPR classes, all of that stuff they sent out in the initial packets. Okay. Then the second packet that they sent out was just prepping us for orientation, pretty much giving us a schedule when we're gonna, how orientation is gonna go, what we need to expect. I've also, they also have this big SIB program, and I'm sure that other schools probably do it too. It's like a mentor program where they put together students from the prior year with the incoming students and so forth and everything like that. So my big sib actually reached out to me on Facebook, thank God. So I've been networking with her and keeping in contact with her a lot, and she's been so great with telling me a lot of things to expect as far as the first couple of weeks even. So that's been really, really helpful. Another really good thing too is that my classmates, they actually started a Facebook page. So I've been able to get in contact with a lot of them. And we also keep in contact via the GroupMe app. So if we have any questions that, we can't get answers out of the packets that have been sent to us, then we communicate that way. And a lot of the faculty they're really, they correspond really well in a timely manner. So it's been pretty smooth sailing since December, honestly. I don't want to speak too soon considering school starts in a couple of weeks. But it's been pretty smooth sailing since I got accepted. They've been really, really well with guiding and getting us all prepared for the first day of class. So good. I haven't had a whole lot of questions anyway as far as what I need to do and how I need to prepare, because they've pretty much laid it out right for all of us.
So you mentioned your big sib, and you have a big sib program at that school, and some schools usually will have something like that, or through one of the student-run organizations that pair people up to kind of help them with the transition. So tell us the details. What did your big sib tell you as to what to expect? Give it to us.
So she was really nice enough to share with me her schedule from last year. Well, we've already gotten our schedules as far as for the first year, but they haven't really. It's not really organized as far as what our time blocks are going to be like or any of that. And she sent over her schedule to me of how her exam schedule was and everything, pretty much. So that was really, really insightful. I'm probably gonna have a test like the second week of class, but
yeah.
A couple of other things that we talked about was basically networking with my classmates. That was really her big thing, was trying to stay connected with some of my classmates and everything like that, because it's going to be like a family now. So that was one of the big things that she was pushing on me. There's a couple other things too. I can go over to some of the things that we talked about. I'm sorry.
All right. So she gave you some tips about the exam schedule, what to expect when your exams are going to be happening. She said, definitely tap into your network of your classmates, because that's going to be your new dental family, so to speak. What else?
And then she also mentioned as far as how my timing is, how hectic not the first few weeks, but how they kind of ease you into the first 2 or 3 weeks of class, and then it all just kind of hits you. So you have to be prepared for all of that to come as soon as they get you eased in, and then it's just like boom, everything all at once. And I know we had a conversation when she was telling me how at one point she felt like maybe this is not the career for me, but just to not get discouraged, because it's going to be overwhelming. So, and I've kind of already kind of had that in my mind of how overwhelming it's gonna get, considering the course load that we're going to be taking, 24 hours in the first semester. I've never taken anything over 15 hours, so that's going to be a whole new ball game for me with the hours and everything like that. So, but I'm looking forward to getting some great mentoring advice and guidance out of the program. I know they'll also put me with one of the faculty members too, or something like that. It's more detailed in my packet though. So that's another mentor type of program that they have as well at the school.
So they've already paired you up with a faculty member as well?
That I actually had to turn in paperwork, a student information sheet that I had to fill out. So based on that sheet, they're going to match each incoming student with a certain faculty member and everything like that. And again, I'm sure that some of the other schools in Texas may have the same mentor program too, but I know A&M that's something that they do, and I'm definitely looking forward to it anyway. So
yeah, that's going to be great.
A lot of good advice and guidance out of that. So,
any study tips? Because like you mentioned, you guys are going to have that first year. You got 24 credit hours. That's your load, which is for most people that's 2 semesters. Did your big sib give you any study tips, any pearls about studying and how to structure your day or structure your studying for the period of this first year? What did she say?
Her main thing that she really talked to me about was prioritizing. As far as it's certain classes that you'll be able to, and I don't want to put this out there to like slack on certain classes. No, absolutely not. But it's certain classes that you'll be able to not have to, I guess, put as much time into, considering the content that it may be. It may be something that you already know a great deal about from like undergrad or something like that, versus like a lot of the new material where you're gonna have to like prioritize a lot of your content. And then she also mentioned with the group study and everything like that, which was something that I did a lot in grad school, was group studying. So again, and that all comes with getting connected with my classmates and everything like that too. So those were 2 really, really helpful tips that she gave me as far as studying and everything goes. So yeah.
Well, I want to share a tip also, and actually 2 of them. The first one deals with the 24 hours, the 24 credit hours, that load. Again, it's going to be overwhelming, but be comfortable with being uncomfortable.
I think that's going to be the best piece of advice that I'm going to have all this year. So
yes.
Definitely will keep that in mind.
That's right. Because it will feel overwhelming, but you know what? There's of the 10,000, there's probably more than that. I forget the number of dentists in the U.S. It's definitely more than 10,000. But those that have graduated, those that have pursued a career, all of us have started in the same place that you're starting right now, which is that first year, first semester. And whether you were a biology major, whether you were a business student, or you were an architect or an engineer like myself, day one, everyone starts at the same point. So be comfortable with being uncomfortable. That's going to be the story of your life these next 4 years, and that's going to be part of the process as well. And the other tip I was going to tell you is, I don't know if you have some thoughts about maybe specializing or not. Have you thought about that at all?
I have, actually. I know it's early on for me to be thinking about that, but I have had some ideas about specializing. I'm kind of leaning towards either endo or oral surgery, if I'm not too burnt out by the time that rolls around for oral surgery anyway. Because I know, well, Baylor, that's the good thing with Baylor. They have all of the specialty programs too. So hopefully, it wouldn't be, I know how competitive it is, but I'm hoping that I can get into one of the programs there since they have all of the specialty. But I'm kind of leaning towards either endo or oral surgery for specialty.
Okay. So my tip about specialty programs. Your process in applying for specialty programs starts your first year. Not after your second year, not your third year, not your fourth year. It starts on this D1 year. Why? Because everybody on day one, everyone has the same GPA. Everyone has a 4.0. Everybody. So your job, whether you're specializing or not, but more specifically, if you are thinking about specializing, is to maintain that 4.0 or at least keep it as close to a 4.0 as possible. Why? Because, again, you said it, you're going to have 24 hours of credits. And the first year, those grades are weighted very heavily in certain classes. And those are the ones that are going to maintain or allow you to keep your GPA up high. Okay? Especially if you're at a program or a school where you have a GPA. Your GPA will be evaluated at some point 3 years from now when you're applying, or even after that, when you're applying to endo and or surgery. So keep that in mind. That's a tip. Remember, you got your 4.0 right now, but so does everybody else. Your job is to maintain it and keep it close. By any means necessary.
Another thing that I had wanted to mention too, I'm not sure how some of the other schools do their boards anyway, but I know that for Texas A&M during my interview, that was one of the many things that they talked about was how they pretty much prepare their students the first year with a lot of the basic sciences, that some of the same sciences that we took in undergrad and everything like that for the first round of boards, which they usually, I was talking to my big sis the other day, and she's actually preparing for them now, going into her second year. So, well, she's already in her second year. So, yeah, she's actually preparing for them now. So that's another thing that I appreciate about the school too, is that they kind of have everything scheduled according to, you know, where you should be at, and as far as like your boards and everything goes and stuff like that too. Yeah. I know a lot of the other schools wait a little later on throughout doing school to take that first round of boards, but for Baylor, I think they take them the summer after their first year, I want to say. I could be wrong about that.
Right. Okay. So one of the things I want to tell you about the boards is this is something you definitely need to know, and you may want to try to find this out within the first month that you're there. In 2020, July 1st, 2020, there is a new national board that's going to start. I just did a video on this not too long ago about the integrated national dental board examination. And what they're doing is they're taking part 1 and part 2 and they're fusing it together, and it's going to be one board. That's why it's called integrated. And that takes effect July 1st, 2020, which is 2 years from now, a little bit less than 2 years from now. So you might, at some point, you might want to, check with the school and find out typically when they have people take the exam, part 1 of the exam, and how they prepare you guys for this integrated board. Because it's very possible that you guys may take it third year now and not after your first year. Or you may take it after your second year. Don't know.
And that was actually something that that all three of I had the opportunity to interview at all three of the schools in Texas, and that was something that they all three mentioned about the integrated boards. And I know that San Antonio, what I recall from that interview was that they were going to give the students option the first year that they implemented that. They were going to give them the option of taking the integrated one or splitting it up into the first round of boards and then the second round of boards. I'm not 100% sure how Baylor is going to go about all of that, but I do recall them mentioning the integrated boards as well. So
yes.
Yeah, it's definitely something that I need to find out. Probably
definitely. And since also talking about some specialty programs, during your time there in Texas at Baylor, I've got a couple of people that I want to introduce you to help you with your network. I have there's an oral surgeon that's in Dallas. She just moved there about a year ago, just started a practice, female oral surgeon that I want to get you connected to, Dr. Portia James. And also there's some endodontists in Houston, which is about 3-4 hours away south of where you're going to be. But they have some colleagues, I'm sure, that are in Dallas, but I have 3 of them in Houston to get you connected with, because also, like I said, that process starts D1 year. It really does, as far as your foundation, your GPA, your study habits, and things that you're going to be doing that are going to help boost your candidacy 3 years later or 3 years from now. So, so your big sib is right about the networking part, not only with your classmates, but also beyond, starting to develop those networks from now as a D1, but also ones that are going to help you as you matriculate through the school and through your D2, D3, and D4 years as well.
Thank you. I appreciate that.
Yeah, no doubt. So
as much as possible, I'm still, when I moved to College Station for grad school, that was one of my big things, trying to find a dental office to shadow at. Even though I had got plenty of shadowing hours in my undergrad and everything like that, I still wanted to go out there and gain more and more experience. And I'm actually still in contact with her name is Dr. Kimberly Haynes, but she works for Aspen Dental, and I shadowed there from since I've pretty much been in College Station. So
okay.
Yeah, I try to stay as connected as possible. So I really appreciate all of the networks.
Yes, stay connected. Stay connected. It's going to be a little bit challenging your first year because you want to be focused on maintaining that 4.0. But when you do get a chance to take a little study break and break up the monotony, if it's a networking activity, you should be there and start developing those networks. Also, I think she's still there. She's the director or dean of maybe diversity and inclusion at Texas A&M. I forget her name. I can see her face. I think she's still there. She was affiliated before the school changed to
Texas A&M College of Dentistry.
Right. She was still with the Baylor at the time. She was still there, but I forget her name. I'm sure you probably saw her doing interviews. You probably will see her during the school year when you start.
I want to say that you were speaking of Dr. Lacey.
Lacey.
I feel like that's who you're talking about.
Might be, but if it is her, that's the person you also want to stay connected to and develop that relationship, because she's put a lot of people in school and helped them not only get them in school, because that's one step. The second step is getting through each and every year so you can get out.
That's the longest. Well, maybe that's the longest part, aside from applying. Aside from the application process, maybe that's the
right.
Part.
But it's like eating an elephant. You know how to eat an elephant?
No.
You eat an elephant one bite at a time. So dental school, it's a process. It's a marathon. But you can only do it one step or 1 year at a time, one semester at a time. That's how you get through the year, and that's how you get through school. One semester, 1 year at a time. So keep that in mind too, as tips as you are continue to prepare for your incoming for your first year of dental school. But it sounds like between your big sib and the things that the school is doing, it sounds like you're all prepared for the most part.
Yeah, for the most part. I've been just kind of trying to relax aside from working. So when I graduated in December, I was working at a dental office, Cool Smile. I don't know if you ever heard of it, but it's like a chain of pediatric dental offices. But I worked there for quite a while before I got another full-time job. And I've just been working on since I graduated, actually. The school's been really helpful, like I said, with keeping us kind of in the loop of everything that we need to do, all of the incoming students on what they need to do as far as preparing and everything. And I guess for me, some of the requirements that were needed, considering I had just graduated, I had already had some of them taken care of, like my CPR certification and all of that stuff. So getting through most of the requirements, I was just trying to be on top of everything and not, wait to the deadline to get certain paperwork and things like that. But yeah, I've just been trying to, aside from getting my finances and everything together, just kind of relax and get myself mentally prepared, I guess. Which was another thing that my big sib encouraged me to do, because I won't have any time after the first 2 weeks of school.
Yeah, relax and chill now. That's relax right. Chill now and get used to getting some sleep as much as possible and drinking a lot of water so you stay hydrated, so your bodily functions are working and not stressed out because you're stressed out and you're not eating or you're not sleeping or you're not hydrating yourself. That can cause a lot of issues for you too. So look, I'm so glad that we connected. I'm so glad that you've got some great tips to help prepare you for this new professional development opportunity called first year dental school.
First year dental school.
Yes. And like I said, keep in mind, be comfortable with being what?
Uncomfortable.
That's right.
There was another quote that I saw you put on Instagram, and I screenshot it. I had to go and screenshot it, but for everybody who's still in the process and don't see the light at the end of the tunnel just yet, just know that when the elevator to success is broken, take the stairs.
Take the stairs.
As I had to with getting a master's and everything, and finally getting my DAT exam out of the way. So it'll happen for you.
That's right. One step at a time.
One step at a time.
One step at a time. One semester at a time. 1 year at a time. Well, student Dr. Jojo Hardin, thanks so much for your time and sharing with us, how you've been preparing or how you are preparing for your first year of dental school. It's been a pleasure, and we're going to stay connected. All right.
Absolutely. Thank you for having me. I appreciate you reaching out to me.
No problem. No problem. Yeah, I want to follow your journey through these 4 years, and maybe after the first 6 months or after the first year, we'll kind of recap and see how you actually survived the first year. Some of these successful actions that you actually put into place so that you can share that with those that will be in your position this time next year.
Absolutely.
Okay. So thanks so much. I appreciate it. And like I said, I'll shoot you the names of that oral surgeon that's there in Dallas. And she can also serve as a mentor and someone to kind of connect with also.
Okay, great. I will be looking forward to that.
Awesome. And if you guys feel that this video was great and you're looking forward to more videos like this, be sure to send me an email right here, newdentistcoach@gmail.com, newdentistcoach@gmail.com. We want you guys to give us topics that you want to find out more about, that you want to learn more about. Remember, you ask the questions and we get the answers for you, okay? Hey, student Dr. Jojo, thank you so much, and we'll talk to you soon. Good luck in your first year.
Thank you. Thank you so much.
You're welcome. Bye-bye.
Bye.